In this video, I want to talk about arterial blood supply to the brain because that is super important for our brain to get a constant supply of oxygen, nutrients, and glucose. The basis for some of this lecture is going to be on a venous circulation known as an anastomosis. An anastomosis is where two different blood vessels join each other without an intervening capillary bed. There's arterial venous anastomoses and there are arterial anastomoses, and that's what we're going to focus on this one. And an arterial anastomosis or arterial anastomoses are a collection of small arteries that are connected to each other, providing alternative routes of blood to the same region of the brain or closely related regions of the brain, which is super, super important for the brain because if any blood vessel gets occluded by plaque or by an embolism, blood can have alternative routes to get to the specific regions of the cerebrum or the cerebellum. This image is showing basically what is referred to as the circle of Willis. It is an arterial anastomosis. Now, to be clear, what belongs in the circle of Willis is up for debate because it's highly variable depending on what textbook you're looking at and what research you're referring to. I am going to highlight what these blood vessels are, and then we'll somewhat be more specific on what the circle of Willis is. This right here is the basilar artery, which is formed by the union of the two vertebral arteries. So this is blood coming up the two vertebral arteries. The vertebral arteries are coming up from the subclavian arteries, and I'm going to show this in a subsequent image. And they proceed up through the transverse foramen of the cervical vertebrae. So when blood merges right here, this becomes the basilar artery. Splitting or bifurcating off the basilar artery, we have the posterior cerebral arteries. This right here is the middle cerebral artery, and right here is the anterior cerebral artery. So this is the right anterior cerebral artery. This is the left anterior cerebral artery. Now, one thing I was remiss to mention is we are looking from inferior to the brain. So this anastomosis, and I realized I wasn't very clear from that at the start, is located on the inferior aspect of the brain. So if you were to take the brain and turn it upside down, you would see the pituitary gland, you would see the brainstem, and the inferior aspect, part of the temporal lobe and frontal lobes. As such, this is the right side. This is the left side, making this the right anterior cerebral artery, left anterior cerebral artery. This is the anterior communicating artery, allowing these two blood vessels to communicate with each other. This is the right posterior cerebral artery, left posterior cerebral artery. And this is the posterior communicating artery on the right and the posterior communicating artery on the left. In black right here, this is where the internal jugular vein meets the circle of Willis. So there is one textbook I have found that actually includes the internal jugular vein, the internal carotid artery as part of the circle of Willis. No textbook includes the middle cerebral artery as part of the circle of Willis. So once again, vertebral arteries, basilar artery, posterior cerebral artery, posterior communicating arteries, middle cerebral artery, anterior cerebral arteries, and the anterior communicating artery. And what I have highlighted, this is the same image, but I've highlighted what most textbooks and research suggests is the circle of Willis, and that's specifically the posterior cerebral arteries, the posterior communicating artery, anterior cerebral arteries, the anterior communicating artery, and some include the internal carotid artery. Once again, the middle cerebral artery is not considered part of the circle of Willis. Neither technically is the basilar artery or the vertebral artery. Nonetheless, they serve very valuable purposes by providing blood to either the circle of Willis or different regions of the brain. On first look, I realized that this image is going to be very complicated, but I think it's very doable, especially based on what I just talked about. Right here is the aorta, specifically the aortic arch. The three branches coming off the aortic arch are the brachiocephalic artery, the left common carotid artery, and the left subclavian artery. Branching off the brachiocephalic artery, we have the right subclavian artery and the right common carotid artery. The word common tends to be used with arteries when that blood vessel is going to bifurcate distal to a certain point. So right here and right here is where the common carotid arteries bifurcate. It's generally around the level of the mandible. Out here is the external carotid artery on both sides here. The external carotid is serving the face, external skull, and regions of the neck. Right here is the internal carotid arteries. This is the right internal carotid artery. This is the left internal carotid artery. This right here and here is the middle cerebral artery. This is the anterior cerebral artery, right and left, and this is the anterior communicating artery. So moving back here, this is the vertebral artery, which is a branch off the subclavian artery. So this is a right subclavian artery, making this the right cerebral artery right here. Left subclavian, left vertebral artery. This is the right subclavian. Coming off of it is the right vertebral artery. Left subclavian, left vertebral artery. Those two are going to join into the basilar artery, which branching off of those again are going to be the posterior cerebral artery, posterior communicating arteries, anterior cerebral arteries, and then the anterior communicating artery. So here you can see that internal carotid artery here and here, which I had highlighted just the opening to that internal carotid artery. That is your blood supply to the brain, the main blood supply to the brain.